want you to know face syndrome? Yes. Then they want you to know where the regeneration is. You know it. These are all done. In here also, they are giving both the choices. So they want you to be extra intelligent. Extra intelligent. And yes, his doubt is correct. If it was buccal nerve, I don't have the option here. But if it was buccal nerve also, then obviously the student get confused. But my answer remains great auricular nerve. Why? Because this area is great auricular nerve here. This is great auricular nerve, and I'll go with great auricular nerve. Buccal nerve is more here on the cheek. Yes, it is on the cheek. It can be also the answer. But the point is, now, how do you reach your answer? You have to look into photographs given in the books. I have seen 7-8 books now. So in those 7-8 books, you will see photographs. Some person having sweating here, 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 here. Some people sweating here, here. So you have to tell where is sweating more, isn't it? So clinical data. You are to become a statistician now. You become a statistician and you collect 1,000 patients. And in 1,000 patients, see which patient has more sweating where. And so what is the answer? Answer is great auricular nerve. What is the second answer? Second answer is buccal nerve. What is the third answer? Lesser occipital nerve. What is the fourth answer? Branches of cervical plexus. Remember the sequence. Sequence number 1, great auricular. Number 2, buccal nerve. Number 3, lesser occipital nerve. Number 4, cervical plexus. Is it given in some books? Is it given in some books? No, it is not. This is what you have to think. If you don't think, then how will you reach your answer? How will you reach your answer? You can't reach your answer. You have to think, and it is dangerous. You know, examiner wants you to think, and when examiner wants you to think, your thinking will take you into wrong direction. So the examiner is trained to make the student think, and the student will think in opposite direction, and that is the purpose of an examiner. Get more and more of wrong answers. That is why he is paid. These people are paid so that most of the students should answer wrong. So they stimulate you that you think. So you should not think. You should ask your expert to think. Whoever is the expert, he will think. And even experts can be wrong. Experts can be wrong. But keep your answer as great auricular nerve. It's a difficult task, you know. It is not easy. It is not easy. Take it from me. But anyway, keep your answer as D. My job is give you best possible answer. Okay? D is the answer. Buccal nerve was there. Yes, I understand. But that is not your answer. That will be your second answer.
So,
okay, yeah.
So fan on करवा देंगे.
Sorry? Fan. Where is the fan? There is no fan.
AC, so
we are using artificial current now. So, okay, question number 6. We are running out of time. Okay, what about this question 6? Question 6 is a repeat question. It is actually a repeat question. You can just keep the door open at least. You just ask them to keep the door open. Otherwise, we'll be having a lot of CO2 here. CO2 narcosis will be here. And everybody will feel sleepy after some time. See, question number 6 is actually a repeat question. I'll tell you some of the features you just remember. You remember the heart is in thorax. The heart is in thorax, and thoracic vertebra has heart-shaped body. So when you have heart-shaped body, it is thoracic vertebra. You remember that thoracic vertebra, the shape of the body is heart shape. It's just simply remembered because the heart is in thorax. So how do you draw it? What you do is you can draw like this. It is this is the body of the vertebra. See, this is the body of the vertebra. So this is the body of the vertebra, and then what about the vertebral canal? When you are talking about the vertebral canal, then it will become oval like this. This is oval. So spinal cord will be running through the vertebral canal. Spinal cord runs through the vertebral canal. And what is behind that is spine. So that will be the spine. That is the spine, and this is the vertebra now. So what is the shape of vertebra? The shape of vertebra is heart shape. And what is the shape of the vertebral canal? Oval. Oval. Now once you know this, so body of the thoracic vertebra is heart shape, but the vertebral canal is oval. Reverse it. When you are talking about the other regions. Other regions means normally they will ask you differentiate between which vertebra? Cervical, thoracic and lumbar. They can ask you to differentiate cervical, thoracic and lumbar. Tell in the thorax, body, heart shape. And vertebral canal, oval. And just the opposite for cervical and lumbar. So, what is the shape of cervical vertebral foramen? What is the shape of cervical vertebral foramen? Heart shape. And what is the shape of the body? Body is oval. You get the point? So, if you remember thorax, then you can derive. You see, never try to remember everything. Remember something and derive other things. It is memory techniques. So what is memory technique? Don't try to remember everything. If you try to remember everything, you will forget everything. So what do? You remember something and derive other things. So what do you remember? You remember thoracic vertebra and you derive cervical vertebra. I am asking cervical vertebra, what is the shape of vertebral canal? You are telling heart shape. What is the shape of cervical spinal cord? Transverse section. If you are talking about cervical spinal cord, transverse section, what is the shape of the transverse section spinal cord in the cervical vertebra? Of course, heart shape. Because spinal cord passes vertebral canal, and vertebral canal has the same shape as the spinal cord. So you are deriving the answers. Okay, one more thing. Remember T-bull. What is T-bull? T-bull means in the thorax, the superior articular facet is directed backward, upward and lateral. Remember T-bull. What is T-bull? T-bull is in the thorax, the superior articular facet is directed backward, upward and lateral. You know vertebra has superior articular facet and it also has inferior articular facet. It is like this. Say if this is the vertebra, it has superior articular facet. It also has inferior articular facet. Why these facet? Because the upper vertebra is coming attached there. Lower vertebra is coming attached here. Joints, intervertebral joints. I am telling in the thorax, what is the shape, what is the direction? Backward, upward, lefward. So they are not like this, they are basically backward, but not only backward, they are also upward. And they are not only backward, upward, they are also lateral. Obviously what the inferior will be like? What the inferior will be like? Opposite, just the opposite, because they have to make a joint. If the superior is backward, what the inferior will be? Forward. If the superior is lateral, what the inferior will be? Medial. Don't try to remember both of them. If you remember both of them, then you will make a mixture. And in the exam, you will answer something else. So remember one, derive the other. Examiner can ask you the lower one. So don't remember lower one. Remember only upper one, because mostly they ask upper one. So remember that, derive the lower one. Anyway, what about cervical region? We are going to compare it with the cervical. In the cervical, just remember that it is only backward, upward. No lateral medial. No lateral medial. What about cervical vertebra? Cervical vertebra, the superior articular facet is only backward, upward. So if I give you an information, I have a vertebra. This vertebra superior facet is backward and upward. So can you tell me, is it cervical or thoracic? Can you? No. Why? Because the information is incomplete. Say I am telling I have this vertebra. In this vertebra, superior facet is backward and upward. So tell me, is it a cervical vertebra or is it a thoracic vertebra? You will say, sir, we don't know. You have to tell us whether it is backward, upward only, or is it backward, upward and lateral. So you are giving us incomplete information. We can't tell. That is how you use this information here. See, in question number 6, what is the answer? Answer is very obvious. See, only the cervical vertebra have foramen transversarium, the very first answer. In question number 6, your answer is choice number B. Very obviously, because foramen transversarium is present only and only in cervical vertebra. What is passing there through that? Body is oval. Vertebral canal is heart shape. The facet is backward, upward, no lateral, no medial. Okay, remember this. Sorry? Don't think about lumbar at all. Don't think about lumbar, you just think about these two. I know it is backward and it is basically backward and upward again. Yes, it is, but they will not ask you. Take it from me. See, you are asking for more information. You are asking for more information. I can give you more information, of course, takes time. But sometimes, wise to limit yourself. It is always wise to limit yourself. This is your axis, and you should limit yourself. Some student will ask, sir, should I read some question which came 15 years back? I say no, only 10 years. Last 10-year questions, that's all. Don't go